Welcome to episode 63 of the Positive Unpublishing podcast. This podcast aims to inspire you with information to allow you to pursue your creative life with a smile on your face. I'm your host, Dr. Catherine Guillet. Learn more about my work at makeeverythingfun.com. My guest today is my dear friend, Marilyn Suttle. Marilyn Suttle is a results coach and customer service expert who specializes in creating subtle shifts in the way people think and act so they can produce massive results. A leading authority in service excellence, communication, and strengthening relationships, as well as content marketing. She's been sourced as an expert by by Psychology Today, U.S. News and World Report, Court Magazine, and many more. Marilyn is listed in the top 10 of Global Guru's top 30 customer service thought leaders for 2020. She has published 3 books, one with a major publisher, one self-published, and a customer service coloring book. How fun is that? Welcome to the show, Marilyn.
Thank you for having me, Catherine. This is great.
So in the pre-interview chat, we were talking about the options of making this interview evergreen, kind of talking about your work, and you've done so much in the area of customer service and more, or getting really specific about helping people during this challenging time around the coronavirus, the novel coronavirus, COVID-19. And we decided we would do both, but that we would start because this is certainly a time when the more information that we as transformational leaders can get out to the public about how we can interact with our service providers, be better customers, be better service providers is so incredibly vital, and your voice is so unique in this area. So what would you say are some of the top things we need to consider during these challenging times?
Well, one of them is overcoming overwhelm. I think all of us are in uncertainty, and having ease with uncertainty is not something we're taught to do. Our natural biology is to go into threat mode. This is new. This is uncertain. I'm scared. And so one of the most important things we could do is to take a breath and be present. Whenever you're feeling overwhelmed or just completely scared, it's because you're either in the past thinking of other scary things that has happened in the past, or you're in the future thinking about what could happen. You're not present. And so if you want to overcome the overwhelm, be here now in this moment with this customer or with this child or with this friend that you happen to be with in the moment.
That's so beautiful. And Marilyn, what I do is I pull out nuggets, and then we kind of, we build off those fun nuggets, and sometimes we go deeper.
Yeah.
So the first one is to be present, to be here now, especially during these challenging times. And it's beautiful how this ties into a recent interview that I did with Dr. Mario Martinez, where he got into the specific brain science around, it's very difficult to heal or to make a lot of progress in that like high beta state when the brain is, hyper focused. And you talked about overwhelm.
Mm-hmm.
And I'm sure a lot of people listening to this or watching this can identify with that feeling of overwhelm. And so you were talking about that presence, which I want to go deeper in that because it might mean some practices to get more present, as you said, and then more centered. And as Mario Martinez would say, more in the alpha and theta brainwave states. So what would you suggest as practices, or what have you seen work with a lot of your clients? And I know you work with corporate clients, or I'm curious what kind of practices they're open to get more present.
Well, this is a vital skill in customer service because I work with a lot of salespeople in automotives where if they lose one client, that's millions of dollars. And so the big thing is to manage your emotions. So this works. And one of the benefits is it helps with every relationship in your life. So you have emotions, but you're not your emotions. You feel them and they can move through you or they can stay stuck. And like when you're angry, but you don't express the anger, but then your eye starts to twitch and your body starts to react. And so a lot of it is just noticing your self-talk. What are you saying about this situation? What are you judging about the other person? And one very quick thing you can do is to take what you consider the negative behavior and look for a positive quality in it. So if somebody is very demanding and it's hitting your buttons, you can ask yourself, well, what is demanding? What's the positive aspect? They know what they want. They have the courage to say what they're thinking. And so you get to know what they're thinking, because all the nice customers or the nice friends don't tell you you have spinach in your teeth, right? So taking a pause to notice, what are you thinking? What is your judgment about this person? Or what is your judgment about this situation? And then not believing, there's that old saying, and it's kind of cliche, but it's true, don't believe everything you think. Challenging your thoughts. Because I have this, I wonder if I have it handy. Let me just take a peek. I have a little card, and on one side it says, I'm just going to make one up for you right here. One side it will say like this. Okay, here we go. Situation, this would be the situation, and this would be the result. Your situation is, we're in the middle of a unknown epidemic, a pandemic. The result depends on what's inside, which is your belief. So what are you believing about it? Because the result you get is going to be dependent. For example, we're seeing all those kids on spring break going to Florida thinking, I don't have to worry about this. Well, what kind of result are you creating with that belief? And can we, one, re-educate ourselves, two, manage our emotions, three, find ways to really get into the humanity of caring about everybody in a way that when we care about others, we care about ourselves. And so those are just quick tips. That makes sense.
And I want to go deeper into one specific area. I'm going to summarize that really quick. So and I'll make this nugget number 2. And there's a pause with each of these. So I'm going to do nugget number 2 and 3. And a pause is important for each of these nuggets to work. So pause, then look for the positive even when there's a negative. So I love that. And then nugget number 3 is, it's kind of Viktor Frankl-esque in that there's that power in the space between. And I love that little piece of paper, but the space in between is that belief. So there's pause because there's a situation, pause, open up, there's a belief in there. And we have the power to control what that belief looks like, maybe, but even better when we take that pause. And then the result is on the other side. There's something I wanted to dive deeper in, Marilyn, because you mentioned an eye twitch. Okay. And I'm a big fan of understanding the somatic relationship, the mind body. And on my other podcast, the Mountain Mantras, I've been interviewing brain spotters and all these, and I'm certified in brain spotting as well. And you and I have been to retreats together where we do incredible healing work that is somatically based. But when you talk about that with your corporate clients, what's the climate like today in terms of openness to really understanding, because in corporate America, which I've worked in for, decades, there's a reverence to the mind, right? To our thoughts, to our ability to think through. And what you and I know, and I want to make sure that we share with listeners, is there's a lot of knowledge in the body itself. So how open are your corporate clients today to kind of looking into that somatic experience? And then any tips for listeners that might be going, what are they talking about, to kind of experience it for themselves?
Absolutely. And I've been bringing more and more of this into my work with clients because I'm certified in RIM, which is also a mind-body process. And I'll tell you, and I'll give you an example because that kind of makes it real. I was working with a CEO who has 3 offices. And by nature, this person has a kind of quick temper, which you might find often with somebody who's a go-getter, makes things happen. They go forward. They're just nature. They can get reactive. And this person had a habit of getting very reactive with one of his employees. And this was a good employee, but he wanted things perfect. He wanted things right. And I was working with the whole team to try to create really good communication internally. So I asked him to get quiet for a moment and just, tell me what he wanted to say to this person. There was an issue. So I said, what do you want to say? And so he said, I got to tell her blah, 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 blah. He was ready to just tell her in that very direct manner. And I said, okay, just for a moment, I want you to Imagine you're sitting in her chair, looking out through her eyes back at you. Tell me when you're there. And he goes, okay. And then I said, so you're standing and she's sitting, you're looking out through her eyes back at you. Yep. And I said, now have her receive what you're saying the way you're saying it. And he went, oh, he got it on a physical level. Oh, she's going to get defensive. She's going to feel hurt. All of these things are going to come up for her. And I said, well, is that the communication you're wanting? No. Well, how can she hear you while you're still in her body looking out through her eyes? What does she need to hear from you so that she can be on the same page? And he had this whole shift and his whole physiology changed. It's like, I could just directly tell her, these are the things that are important to me. And how can we work together to make this happen? And she'll cooperate. She likes to get things done too. So that's an example of mind body, where you're actually going not only in your own physiology, but in the people you're talking to. How will they receive what you're going to say? What do you think? Because we really are intuitive people if we allow ourselves to be. Does that make sense?
Yeah, and even as if you're a CEO listening, it's possible. And thank you, Marilyn, for bringing up RIM. And we both know Deb. Well, maybe I'll bring Deb on the show to kind of go in depth on how that method works. I know Jack Canfield is a huge fan of that method, but the idea is, and maybe this is fun nugget number 4, is that compassion and empathy at a somatic level is really key to relationships. And you mentioned like experiencing the somatic experience of the other person. And I wanted to go into the experience because you're a guru, you're well known in the world of customer service, and what's going to happen or what is already happening in the world of healthcare, and being in that world either as a customer or as a service provider. And Marilyn, and so we'll look at it from both ends. And folks, the reason why we're doing this is because you might find yourself needing to be in the healthcare system to visit somebody, or maybe you can't, or maybe you need information, or maybe you're a patient, or maybe you're listening to this and you are a nurse or some healthcare practitioner, and you're feeling that overwhelm and the fear that Marilyn mentioned earlier. So I want to look at this from both sides, Marilyn.
Mm-hmm.
And I want to also tell you, before this whole coronavirus actually became a big thing, I actually went to see my doctors in Chicago. I traveled to see my doctors in Chicago. And it's interesting, Marilyn, because being a patient in the system is fear inducing. It is overwhelming. And when I went, I was just going for my annual, but like I get really like upset, kind of not upset, but just I get anxiety when I go to see my GYN. And I went in and there were 3 women sitting behind their little desks. There weren't that many people in the waiting room, which is nice. And I went in and there was like one person on the phone. There was another person like typing. And then there was another woman that was just sitting there. And I walked up and she literally like bit my hand and said like, step back and wait.
Oh.
And I was like, oh my gosh, like, it's just to be treated that way when I already felt very anxious.
Mhm.
Anyway, so I'd love for you to kind of talk. So that's kind of the healthcare provider and all the interface personnel that are dealing with clients and patients today. I'd love for you to present some expert advice about how they can be more compassionate. She certainly might not have known what my somatic experience was on the other side of her interaction with me. And
Right.
then I'd love to shift into how we as clients can hope for better service, because we
Mhm.
talked in the pre-interview chat about how if we're nicer, I always bring like a little Dove chocolate to the person that takes my blood. Like when we're nicer to the people that we interact, we get better service. But let's first start with, if you're listening and you might be in that point right now where you're in customer service, and maybe it's even somebody that's taking phone calls from, a prescription filling service, and people are panicked and they don't know if they're going to get their thyroid medication. If they don't have the thyroid medication, they're going to suffer all these consequences. So what would you suggest to really, center and have more compassion for the people that are providing services to a bunch of overwhelmed people right now?
Right. So again, we're going to managing your emotions, but also bringing up some awareness. Because here's the thing, I work with a lot of medical professionals, and they have tasks to be done, and they have to get everything right and recorded correctly. There's a lot of paperwork involved. And I know one of the big things is, when you're face to face, which we're not right now, for the most part, everything's over the phone or online, but they're wanting to do a good job. So they're looking down at the paper to get everything done, and they're not making eye contact. And that might seem like no big deal, uh, but it is that first impression that makes a difference. It's that connecting moment. And if that connecting moment is you looking down, you might be thinking, I'm doing my job. I'm taking care of this person. I've got a lot to get through, task focused. And we need to remember to start and end people focused, because it will change the entire relationship. And so I often say, if you're a service provider, and it's all about touch points, and your touch points are right in the palm of your hand. Your thumb is you up, down, or neutral. Are you giving them a positive experience, negative, or neutral? And I know we all know this, right? But it's important to ask before you even talk to the customer, which am I picking? I'm going to pick positive. It's easy to say, oh, neutral, I'm busy. But it doesn't take much. A smile, using a person's name. That kind of humanizing moment in the beginning makes a difference. Okay, your first fingers, first impressions. So first impressions, notice the tone of your voice. The person before you might have frustrated you. Do you carry that frustrated tone into the next conversation? Need to focus on treating this person like they're somebody you care about, because the fact is, and it's cliche again, but it's true, customers don't care how much you know until they know how much you care. It's that caring that says you matter. So even though you might think they do matter, I wouldn't have a job without them, it's easy to get caught up in, oh, another one. So that first finger is first impressions. The last finger is last impressions. And we often overlook this, where that last moment with somebody, like with doctors who will sit down and talk, make eye contact, that last few seconds of the conversation, are less likely to be sued. There's a whole science to this. People want to feel like they matter. And so, you've probably gone retail and bought something expensive, and they were all over you until you paid, and then crickets. It's like, hey, I'm still here. It's how do you exit the conversation? Thank you for coming. I hope you feel better. Please let us know. Those last moments of what you say matter. In banking, to say thank you for your business at the end, to have them realize that matters. Then we've got the middle finger, which is not the one we want them to give us, but it's the tall one, right? So the tall finger is the high point moments, the high emotion moments. And this is where high vulnerability is. I was working with a hospital, which is featured in one of my books, who, when a patient would come into emergency, they'd say, well, close the curtain, take off your clothes, and put on the robe. Well, that's very vulnerable. And so they consciously added, for your privacy, I'll close the curtain as you undress. So now they've consciously said, for your privacy, where the customer never even thought, oh, they care about my privacy. Now it's changed the whole dynamic of that vulnerable moment. Oh, they care about my privacy. So those high emotion points, and that's also when the customer is acting their worst, which is when they need you the most. When they act their worst, they need you to care about them the most. And that might just be to realize internally, they're having a moment. I've had moments. I can be great with you. And I had one client who said they had a high emotion client, and they were super great with him. 2 weeks later, he committed suicide. And that service provider said, I might have been the last person to be nice to him. I am so glad that I chose that, because we don't know what's going on with our customers. We just don't know. So those high emotion, high impact moments, that's when you dig into your compassion, see the human behind that. It's a person, not a problem that you're dealing with. And that leaves this one finger here that, you know how there's always one kid that gets left out, the kid in the middle. Well, this one left out finger gets left out a lot, and that's the subtle touch points, the subtle touch points. And it's a play on my name, but it's true. It's those subtle things you could do. You don't have to do, but it makes a big difference if you do it, which would be if you're in the medical profession, and they say, can I use the bathroom? Yeah, it's down the hall. Yeah, let me show you where it is. You know, people are in a high scare emotional state, and you guiding them to the bathroom, guiding them to where they need to go. You know, it's like a breath of fresh air. Somebody's taking care of me. I need that. You know, the customer's longing for that. So right in the palm of your hand, you have your major touch points, and you could just go through them, even digitally touching your fingers to remind yourself, I'm doing this because I'm choosing to be this way. And the result is my humanity is growing. And it's really not about how they're treating you. That's their karma. It's how you're treating them, how you choose to show up despite what other people are doing, that says volumes about who you are. And one last thing I want to say about that is that means you need to self-soothe. They're not going to soothe you. You need to do that for yourself. So internally, self-soothe. Remind yourself, I can, you know, this customer is very angry, not at me. They're angry at the situation, and I can be great. I could be their guide out of this frustration. You know, I don't really like what's happening, but I'm really proud of myself that I am being a caring human being in this moment. And man, I'm going to take a bubble bath tonight because I'm going to need it. Right? We want to self-soothe in a positive way, not the drugs and alcohol way.
Mm-hmm. Yeah, so important right now. I'm telling everyone, you know, no sugar, no alcohol. You got to keep your immune
Yes.
system strong.
Yeah.
And you talked about, you know, beautiful ways to soothe. And it kind of reminds me that I'd love to get into the side, because I'm sure a lot of people are going, what if I get into the healthcare system as a customer? And so how do I make these subtle shifts to interact better with my healthcare providers in order to receive better service? But I wanted to summarize before we go there.
Sure.
And this is from the side of the customer service. And I love, Marilyn, how you work with organizations and their sales and their customer service departments to create these subtle shifts, so that, because customer service is so incredibly vital. I was actually talking, this is a little tangent, but I was talking to a venture capitalist, and he was talking about, you know, when you're looking at an exit plan for a company, you know, companies are, yeah, there's a revenue multiple and profit multiple sometimes in terms of determining a price, but oftentimes it's companies, when they're acquiring another company, they are looking for things like a culture, or they're looking for things like processes, but really that customer loyalty and relationship. And he gave me a few examples of some customers with some companies where, you know, their multiple on the sale of their business was just so much higher than industry standard because of those things. So I want to emphasize to people that this is very meaningful to whether you're in the business world or you're a consumer and want to experience the best of, you know, when you're out and you're receiving services or you're buying products. I wanted to put in also nugget number 5, which is that when you're in customer service or sales, or actually any level of organization, connection is your job. So you talked about that person that was like, I'm doing my job, I'm entering data. No. That's a subtle shift, Marilyn. I love your subtle shifts.
Mhm.
It's the connection is actually your job, and to remember that. And I'll put in the show notes, if it's okay with you, Marilyn, I'll put the whole hand touch point things, because I love how you work with organizations with these simple tools, but profound, to allow people to remember, because it's not necessarily about just hearing something. It's about integrating it and actually putting it into practice.
Right.
So let's get into a really meaningful, difficult topic, which is, if I am going into the medical system right now as a customer,
Mhm.
I maybe have somebody in my family or my network that has the virus, or I do, or, you know, and I really, and it's in there. What we're seeing in Italy right now is that it is a high intensity environment. Overwhelm is going to be there, anxiety is going to be there, all kinds of emotions. So how do we handle that as customers ourselves?
Well, coming in, there is fear. There really is. We're being told there's not enough respirators, and we're looking at Italy where the doctors have to decide who gets one. And is it going to be your mom or is it going to be somebody else? And how do they figure that out? And what if it's me? So we have fear in us. That's for sure. So going in, if you act from that fear, you're going to put yourself into a spiral. What if you go in and act with that sense of, I'm going to do everything I can do on my end? There's a saying, I love this saying, you are always 100% responsible for 50% of every relationship you're in. So you're about to enter a relationship with the medical professionals as you walk in. So choose who you want to be. So if you want to be persistent, great, be persistent. Persistence pays, but you could be kind persistent instead of angry persistent or threatening persistent. Because the truth is, when you're threatening to a medical professional, all of their emotions get in the way. They're going to feel it and they're going to have to manage it. And now you're slowing down progress. So you can be persistent. You can be, ask for what you want, all of those things from a standpoint of clarity. This is what I need. This is what I'm afraid about. And sharing, I'm really afraid that I'm not going to get a ventilator. Could you help me through this? And you'll likely hear at this point in the game, we're going to take care of you, and all the things you need to hear. Now, here's the thing: is a shift that's going to be all future paced, because the world is changing because of this. We're going to have new ways of thinking, new ways of behaving. And as a customer, we now have a new responsibility that we never saw that we had before. We are responsible for the well-being of the service provider, which has never been the case before, in that you could be bringing that virus to that person. And that person behind the desk, or that person who's taking your temperature, has a family. And they are risking their lives to be there to take care of you. And even, I saw a beautiful video the other day, the delivery people who come to your house, UPS and FedEx and all of those companies. A woman, she put out a basket of bottled water, candy, different things, and said, "Thank you for taking care of us, but with all these deliveries, take what you want." And I don't know if you've seen it. It's a viral video going on, and it shows this guy, and he's just like, "That is so nice. That is so nice." And he's just overwhelmed with the kindness of that. And he took a couple candy bars and a pop and took off. Or pop, I'm talking Midwestern soda.
I'm from the Midwest, so I totally understood. But
Right.
that's so beautiful. I wonder if I can find that video and put it in, put a link in the show notes.
I'm sure you can, because
Wow,
it was viral. It was beautiful. But you know what? When we as customers, when we as human beings are compassionate with other human beings, being service providers, it just makes everything so much more connecting. It's the relationship, is who you're choosing to be. And this is what changes the dynamic. They say that energetically, you will create the world you think about in your head. So if you're thinking everything's a threat, everything's horrible, people can't be trusted, you're going to energetically draw that to you. People will feel that energy, and the kind people are going to move away from you because you're really intense about those things. So if you can create an inner climate of, I care about my family and I care about your family, who you are as a customer is going to change the dynamic.
There's so many nuggets in there, Marilyn. Let me see if I think you have just such wonderful work, and the subtle shifts that you create with your clients is just so beautiful. So I'm going to try to summarize. And I love that 100% of the relation. You are responsible for 100% of your part.
50% of every relationship. That's a
Of
Wyatt Webb quote. Yes.
Oh, I love that. Okay, so that's a huge one, just for people. Allow it to land with people, and then that idea that we're all human beings, whether you're providing a service, receiving a service, providing a product, receiving a product. Remembering that on both sides, people are human beings with their emotions, with their families, with their histories, with with their futures, right? And
Mhm.
really, landing with that. And then you got into I love woo. You got into the whole, like, you energetically create the world with your emotions. So will you talk a little bit more about that? Because I'm open to all that. And I hope some of the listeners would be willing to hear how that works, how our energetic, I talk about frequencies, how we can raise our frequencies to the positive realms,
Mhm.
get out of shame and anger and shift. There's a shift in the map of consciousness with being courageous. And then we get into, love, and I always say love and above, but how
Mhm.
can we energetically shift? What are some of the practices you recommend for your clients?
Well, one of them is just starting to become aware of your reactions. What are your typical reactions to certain situations? Like if you're driving and a car starts tailing you, going right on your tail, driving really fast in the fast lane of the expressway, um, how would you feel? Like if I ask that question, most people say, I'm angry. It's like, how dare them? And I said, oh, so you've already decided that that's how you feel and it hasn't even happened yet.
Mm.
So, in other words, we have habitual ways of feeling about certain situations. And as soon as you're aware, that's when you can change it. You cannot change what you're not aware of. So, start to become aware of the emotions and reactions you have immediately. Like when you watch the news, whether regardless of which political party you're for, where does your emotions go when you watch something? Do you go straight to anger? Do you get scared? Do you need to go on Facebook and rant? Like, what do you typically do? Because once you see what your typical behavior is, it's like, that's a choice. And we don't often think that, there's a saying, oh, that's just me. No, that's just what you choose to do. So we can shift from that typical behavior by asking ourselves, is this serving me? Is this serving others? Is this really how I want to show up? If we say, well, I never thought about that. Well, how do you want to show up? What do you want to be known for? And those are deep questions to ask yourself because and this I'll do in workshops, especially around customer service, what do you want to be known for? If your coworkers were to describe you, what would they say? Is that the way you'd like them to say about you? What about your customers? And we start to really look at, oh, well, if they are seeing me this way, what is it I'm bringing to the table to make them see me as critical or snappy or difficult or kind or in a pushover? We don't want to be a pushover either. Here's the thing: is we think if we're going to be hard or we're going to be pushovers, and the two extremes are never the right place. Just like parenting, right? The uh, overprotective or the completely neglective. It's that place in the middle that we want to move to. Resourceful, balanced, caring, thoughtful. You matter, I matter. Let's work from there. Does that make
Mm.
sense?
It's like Goldilocks, right? I mean, she didn't want the really hot porridge and she didn't want the cold porridge. So it's like we all need to just remember our fairy tales and the things that the books that we read. There was so much goodness in all of the lessons that we learned in these books. And
Right.
that brings me to talking a little bit about your books. We've got about 10 minutes left in our interview, and I want to give you time at the end because right now we're in a world reset and things are going to change in the world of businesses. And I'm sure people listening are experiencing shifts in how they work, how they interact with their customers. And I want to allow you to talk about how you work with clients
Mhm.
and how you might be in touch and how that might be shifting. Like I know you give workshops and you do in-person training, but as we move to some of the online things in the immediate term, I know you also work with corporations and clients over Zoom and other online platforms. So I want to give you a chance at the end to provide all the links and information on how people can reach out to you, because this is such an important issue during
Right.
this huge world reset. But also a little time for your books, because you are a very unique author that has had the experience of the traditional publisher and the self-publishing, and then you like rode that wave, that color book wave or coloring book that was such a and so I'm curious if you want to talk about how you we're able to foresee that, because a lot of aspiring authors are like, how can I time my work, my content? And by the way, folks, it's a great time to be writing when you're hunkering down. How can you time your content with some of the things in the world? For example, Marcy Shimoff, I work with her, and she was very clear about like happy, like she hit the happiness movement when it happened. She hit the love movement, and now she's doing other work in her transformational leadership areas. So it's about kind of that timing, and you hit the coloring book craze. So
Yeah.
let's just, I'm going to let you pick kind of what area, if you want to talk about how it's different to be a self-published author versus traditional. I think that would be interesting to the authors. And then kind of how you were able to identify a trend and get in on there. I think that would be really cool if we have time, and of course, leave time for allowing people to find you and to follow you and all that good stuff.
Perfect. Well, what I want to say to your listeners right now is, if you have an expertise, whatever field you're in, you have a book. And you might think, well, there's a million books on sales, or there's a million books on that or this, but they haven't heard your story, your voice. And people need to hear more than one story to get it. So there's room, like within the customer service realm, it's an evergreen topic. And I brought, the first book was Who's Your Gladys? And Gladys is your difficult customer. I use the name Gladys. It could be Tom, it could be Rajesh, it could be anything. But we want to humanize it, because we often think that customer, that problem, so we want to give a name to that person. And I'll tell you what, right now, there's a lot of Gladyses out there in the world. So coming in to see them as humans, that was my goal. And
Marilyn, I'm going to stop you. Will you just describe for listeners what, I know what a Gladys is, but just describe for them what you mean by Gladys.
So Gladys is the customer that requires more of you. And we all have a different Gladys. So for some people, it's that cold, cool, austere person who just doesn't seem to care. And if you look at a cold person, who are they really? They're somebody who's slow to warm up, slow to trust. My heart closes to a cold person. It opens to somebody who's slow to warm up. It could also be the demanding one, or the one that yells, or the one that just keeps asking questions. So whoever your hot button is your Gladys. And sometimes Gladys is your boss or a coworker. So we look at different ways of managing that relationship, because if you're good with the most difficult customers, you're going to be amazing with the rest of them. So again, and who you become in the process, you're going to be great with your family and your friends and the community. So it's a skill that is not only great at work, but in life. And so with the first book, my co-author and I, we decided we wanted a major publisher. And so we started a blog, and we blogged to find our voice, and we interviewed, and we just put our work into a proposal. We didn't know how to make a proposal, but we got books on how to do a proposal. And then we had to find an agent. We didn't know how to find an agent, but I was part of the National Speakers Association, which I'm still part of. So I reached out to friends who had published books and said, how do you do this? So you can ask. What you don't know, you can ask and find out. So we ended up with a proposal. We ended up with a major publisher by finding an agent who sold it to American Management Association's publishing arm. And we got a check before we wrote the book. So that was very exciting. And you could choose to go major publisher. It's hard to get a major publisher, but one of the benefits is it was in every bookstore across the country overnight. That was very exciting. And it did hit the bestseller list. So that gave us instant credibility and moved the company forward. But you could also self-publish, which is very popular right now. And that's why the second time around we did. When you self-publish, you get the lion's share. I think we got maybe $1 a book with the first book, with the publisher. Second book, you get the lion's share. So for back of room sales, that made sense, right? So I did actually a whole day training on book publishing for my National Speakers Association chapter recently. So this is an area where you reach out. There's lots of answers to every question. Go on YouTube, look it up. You will find out how to do everything you need to do. But do right. If you have even an inkling of desire, do it. If you want to grow your business, do it. Then as far as the trends, I notice a lot of people doing these coloring books on, a lot of them are irreverent, things that with a nice 4-letter word in the front. And I didn't want to do that, though. I really wanted to help a stressed out service provider feel good, relieve stress. And when you're coloring, you're moving from the logic centers over to the creative centers. It soothes you, it relaxes you. And then what I did is on each page, I had a sentence starter to help people. I'm just opening up randomly. A time I supported a team member was ... And so while they're coloring the page, they're remembering a time when they were really helpful, or when a team member helped them, or when a customer complimented them. And those kind of thoughts, now you're shifting your thinking, you're remembering all the positive things you've done, you're getting into the idea part of your brain. And I just did a training the week before the whole coronavirus hit, and the whole room was coloring during the break. And it was just so fun because they just started laughing and smiling. Mood shifting is really helpful, especially when you're dealing with a lot of difficult customers. So I always look, what songs are going to lift you up? What kind of breathing practice will lift you up? There's so many things you could do to de-stress. And so that, I don't want to go too much into detail unless there's something specific you think that your listeners want to hear. But I just want them to know that there is a way to do it. Even if you've never written before, even if you think you're a terrible writer, there are people that can support you and help you write it, or even write it for you by interviewing you, but you can do this.
Well, thank you for that inspiration for listeners, and that nudge. I think it's really important for people to feel that nudge and that positive affirmation as they go forward. But what you just described in terms of your coloring book, it's beautiful because it's not only that trend, but it's the integration of what's happening now with the brain-body wellness and the integration of the right and the left brain, and how you work with clients to better understand that. So you're such a pioneer. And I love your subtle shifts, subtle yet profound. So tell us how we can learn more about your work, where we can find your books, where people can contact you about having a workshop for their company.
Well, you can go to my website, which is www.marilynsuttle, MarilynSuttle.com. And there is a contact button on that page. You can email me directly at Marilyn@marilynsuttle.com. And I would love to talk with you. I'm happy to get on a Zoom call and just get a little background on have a discovery call to see what it is you need. I love to be of service. It's my passion. And it's my pleasure to do that with you.
You are so generous, Marilyn. So I will definitely put that in the show notes, the links where people can reach out to you. And I'm going to title this episode, I believe, Create Subtle Shifts during Challenging Times. And yes, it's in particular to the area of customer interfacing areas of the organization. But what you've provided for us today is truly how we can navigate as human beings during these times. So I appreciate you so much as a friend, as a colleague, and I appreciate you coming on and sharing all of your wisdom with the listeners today.
Well, and I thank you for what you're doing with your show, because you really are contributing to the success of everybody who watches it.
Sending much love. Thank you.
Take care.